Hello everyone. I would just like to ask first, do I correspond with any of you about mutual patients? I know perhaps some of you by name, if not face. One or two only, okay. As a haematologist, about 80% of my clinical practice is people with cancer, cancers of blood, bone marrow and lymph glands, essentially. And in 1998, I'd been back for about 4 or 5 years from my time in Europe, and it was a chance comment from a patient of mine called Roy, real name, that precipitated a chain of events that has culminated in SolarisCare. His comment to me was that it took him 3 months to learn how to be a patient. And when I asked him what he meant, he said, well, first of all, I had to learn the geography of the hospital, and all hospitals are rabbit warrens. Then I had to learn the language of medicine. I had to learn about the biology of my lymphoma. But then crucially, he said, I had to learn who I could talk to about what I was doing to help myself. And it transpired, and it's still the case, that patients sit in the waiting room and swap war stories. And they'll say, look, for heaven's sake, don't speak to nurse X or Dr. Y about the fact that you're trying this, because they'll dismiss you. They'll be totally dismissive and you'll feel awful. And that was a sort of crystal clear road to Damascus moment for me, where I realised that either I was going to buy into the whole area of complementary and alternative medicine, or forever have a gap between me and my patients. And that was unacceptable. And so I made the decision in 1998 that I would start looking into this whole area, so that I had something to say and could give my patients some advice, and so that they would feel free to talk to me about it. A few years later, through a chance contact, the opportunity came to refurbish an area inside Sir Charles Gardner and start a cancer support centre, which started as the Peters and Browns, and that's evolved into the SolarisCare Foundation. We now have 4 centres and a number of other activities that you'll hear about. So to set the scene, in 2005, for the first time, Australia had 100,000 people living with cancer, the title of tonight's symposium. And in Western Australia, the sad figure now, 1 in 3 Australians will be diagnosed with cancer. This is a slide provided by Rhonda Coleman, who's the director of the Cancer Network, which makes the point, time along the bottom, projecting several years into the future. The linear mortality is the line along the bottom, previous, current and projected, and then the blue line is the prevalent cases. So in other words, what this slide shows is that the number of people living with cancer in Western Australia is set to double between 2000 and 2020. And that's a big resource and logistic problem, not to mention a human problem. From the patient point of view, surveys in cancer populations in the US, Europe and Australia consistently come up with about 40 to 70% of cancer patients will try some kind of complementary and alternative medicines. And some of these are dangerous. And so if nothing else, there's a rising burden of care for us in the medical profession to know enough about this to be able to safely advise patients on the issue. GPs are way ahead of specialists, I would say, and surveys back that up, in terms of acceptance of various complementary medical practices. And there are historical reasons why there's been this schism between Western mainstream medicine and the world of complementary and alternative medicine. Those historical reasons include, or in fact stem from, René Descartes in 1641, whose philosophical treatise was subtitled On the Distinction Between Mind and Body. And that became a dogma in Western medicine until the last 20 years, where there are increasing lines of research that are linking the mind and the body back together again. For example, depression might be associated with an increased risk of relapse of breast cancer in some studies, and so on. Definitions. It's really a tragedy that complementary and alternative medicine survives as a term because it's complementary or alternative. The two concepts are quite mutually exclusive. Alternative medicine is done in place of what we do. Complementary medicine is done as well as. And indeed, all of the major cancer centres around the world are moving to the practice of integrative oncology. The MD Anderson Cancer Centre in Houston, the Sloan Kettering in New York, the Johns Hopkins in Boston, UCLA, Stanford, all of these major institutions now have departments of integrative oncology developing ways to integrate and get the best out of complementary medicine alongside Western mainstream medicine for the benefit of patients. So it became apparent to me on my own kind of journey that in making this decision it was a lot of work. And this slide summarises it. Up to 1999, if you did a search on CAM, on PubMed, you'd get about 700 publications. This year it's about 40,000. And it's not as if you just have to read about good quality randomised controlled trials of Reiki and breast cancer, for example. If you buy into this, you start to appreciate that you have to learn fundamentally different understandings of health systems, Ayurvedic medicine, Chinese traditional medicine, and so on. And that's a role that I've taken on in SolarisCare to try and broker ways of accessing that information and returning it back to the medical profession in ways that are digestible. So this is the potted history of the foundation. Started as the Browns Cancer Support Centre. Some of you might even remember the ads on telly with me as the talking head. Browns donated 5 cents a litre for every litre of milk sold, and that raised $200,000, and that was the money that we used to build the first centre right in the middle of a tertiary teaching hospital. Very radical at the time, and I can tell you that I got letters from concerned colleagues worried that I was exposing patients to quackery, and I can tell you I have still, if you Google my name, a Ben Spoon Award from the Australian Skeptics Association for quote-unquote the most preposterous piece of pseudo-scientific piffle. I hope by the end of this talk you might get an insight into why I disagree with that nomination, although I am quite proud of it. The centres function on 3 levels, really 4. The first level is just a quiet drop-in area. Each centre has meet and greet volunteers who are amateurs. They're trained in self-awareness, they're trained to listen, they're not trained to counsel, and people can just come in and have a cup of tea. Carers, patients, anyone, anytime, any hospital. At the second level, we provide information. We have a computer access, we direct people to the better websites, we triage patients to other support centres, and our philosophy has always been to be as inclusive as we can. And we have a good working relationship with the Cancer Council. The third and controversial level was to give patients access to safe and supervised and vetted complementary therapies. And this was based on a literature review which I'll summarise for you in a few dot points in a slide or two. And at the fourth level, for me, the future of this area of medicine is to produce and publish high quality research. Doctors, however sceptical, will change their behaviour in the face of good quality evidence. And that's what's needed very much in this area. And for this reason alone, I'm diametrically opposed to the Friends of Science in Medicine who've called for complementary therapy courses to be pulled from Australian universities. We need data collected in an open-minded and rigorously scientific way. So, we set up a research committee. We modified something called the Edmonton Distress Scale from the area of palliative care nursing with help from Linda Christensen. And we started recording. We got all of our practitioners to get patients to complete these quality of life and symptom distress scales before and after treatment sessions. And I might add that the treatments that the patients receive is very much ad hoc. It depends on what's available at the time in terms of therapists and free sessions. The treatments are all free for the patients. They can basically have as many as they like. And it seems in my own practice that the act of going into the centre works on a psychological level sometimes quite powerfully. And the first message that the patients get is that the hospital wants them to buy into their illness. The second thing that seems to happen is that in choosing to try some therapies, it can be the first step towards changing from, oh my God, I've got cancer, rabbit in the spotlights, to, okay, that's my diagnosis and this is how I'm going to deal with it. The jargon word for this is empowerment, and our experience is, and we've developed an empowerment scale, that complementary therapies are very empowering for cancer patients. We became a foundation in 2006, which is also the year that we started the Chemo Club. I was sitting in the gym I go to at Claremont Footy Club, the hallowed turf, and talking to the guy who runs the gym there and saying that I wanted a gym to be built in a new cancer centre at Charlie's, and in fact there is a small one there. And the reply was, hang on, I've got one of them, and within 4 weeks he'd set up the Chemo Club with volunteer nurses, exercise physiologists and a physio. Starts with a walk around the oval, and then the patients get supervised resistance training, and they all go there with their bandanas and swap war stories. I vividly recall walking around the oval one time and talking to a lady who was 3 months out from chemotherapy for breast cancer, and she said it was a red letter day. It was the first day she'd been able to brush her teeth without vomiting. And we underestimate, I think, the impact we have on people with our treatments. In 2008 we opened a second centre at St John of God, the Jack Bendat Family Comprehensive Cancer Centre at St John of God in Subiaco. And some of you may not be aware that there is a potential conflict between Eastern complementary therapies and Western religion. And this is best exemplified by an edict issued by the bishops of the US Catholic Church advising Christians not to have Reiki because it was un-Christian. The priest who opened the centre at St John's blessed the area and in so doing dedicated the area to the healing of all people according to their religious beliefs. And I think that was beautifully put. SolarisCare is not a spiritual organisation as such. 2010 we opened a centre in Bunbury. We got a grant from the incoming Liberal National state government. We bought a property and modified that into a clinic near the hospital there, and now we have a centre in Albany as well. These are the therapies that we've offered. And some of you may be appalled by some of the practices on this list. My reading of the literature, which we published, the reference isn't on there, but it was in the Internal Medicine Journal of the Royal Australian College of Physicians in 2006, is that there's level 2 single centre randomised controlled trial evidence in support of particularly massage and touch-based therapies. There's absolutely no evidence in the literature that massage promotes the spread of cancer. There's very good single centre randomised controlled trials in support of music therapy, particularly in bone marrow transplant patients. It reduces depression, reduces time in hospital. Acupuncture in trials reduces nausea from chemotherapy, particularly when it involves something called the P6 pressure point on the left wrist. And there are good randomised controlled trials, in fact, in acupuncture using sham acupuncture needles like stage daggers, where the needle disappears into the sheath of the needle that the acupuncturist uses. And there's one study, for example, done people with rheumatoid arthritis, showing that if you have sham versus real acupuncture, those patients that receive real needles have quite different positron emission tomography scans of the brain, suggesting central activation of pain control pathways. Conversely, it's clear from the literature that psychotherapy group counselling sessions are a mixed bag. Some of them have reported incredible results from 6-week sessions, Others seem to have had no impact on the physiology of the participants at all. And it's clear to me, I think, that these potentially done badly can be very harmful psychologically to people with cancer. So we've offered a range of therapies that essentially are mind and touch-based treatments, some carefully vetted psychological interventions and acupuncture. And probably the most controversial of our treatments is Reiki, which is a hands-off massage. I've had some sessions. In fact, I've tried a number of these myself, and I can safely report that in most of them I fall asleep. The therapists tell me that's actually okay. Strangely enough, some of our patients have reported very profound, almost hallucinatory experiences during Reiki that are very difficult to explain. And I want to share with you a story of a patient of mine who was a retired surgeon who was actually dying of cerebral lymphoma. And we had no treatments left. We'd exhausted all the chemo and radiotherapy options. And he was in a state of utter psychological anguish. Literally could not sit still for the anguish of his situation. And I said to him on a ward round on Thursday, why don't you try something down in my support centre downstairs? And then I saw him again on Saturday morning, ward round, and a changed man. And he said that the session of Reiki was the single best thing that had happened to him in 6 or 8 weeks in hospital. And he'd gone from this incapacitating anguish to saying, okay, I've got this and I'm dying. How can I get home and spend my time as well as possible with my children? So there's another role potentially in the palliative care setting for complementary therapies as well. We've collated data on about 1,800 cancer patients and also, in fact, on 400 carers. This is one of the summary slides of that data, which shows an 8% reduction in symptom distress for each of 6 treatment sessions. We have a similar improvement in a global psychological quality of life score for those 1,800 patients as well. Now, it's uncontrolled data. There's no control group. It's very hard to do randomised controlled trials in this area. But this evidence, coupled with the fact that we've had no significant medical misadventure over 11 years now, has led me to become very confident in saying that I think this is safe, primum non nocere. So this is the owner of the gym, the legendary Smithy. He's very famous in the sporting world. He counsels and has guided a number of sporting superstars to great achievements. Starts with a walk around the oval, and then for the reasons that Daniel has wonderfully outlined, there's a focus on light resistance training to preserve muscle mass and reduce fatigue in particular. One of the extraordinary things about SolarisCare has been, for me and the members of the board, the degree to which it has functioned as a very effective transformer of this wellspring of goodwill in the community to help people with cancer into something very tangible. And this theme of community is a strong one in SolarisCare. And this Red Sky ride started as a couple of business people, Kim and Debbie in the bottom picture, photographed with a patient of mine who lives in the country. And they decided to do a ride annually to raise money, and they selected SolarisCare. And the ride's been going for 6 years now. It's raised $1.5 million. There's a digitally enhanced photo on that side. That's me with my thumb up. It's been digitally enhanced to look as if I'm enjoying myself. The ride I did, for example, did 850 kilometres in a week. So there are other activities. We do bereavement courses called Men in the Kitchen, where we teach recently bereaved men how to cook, and it's a chance for them to get together and talk about things like what to do with photos in the house, when to start dating again, when to take the wedding ring off. We run Support the Carer courses in Perth and in the country as well. We're currently in our first survivorship course, and I spoke to a bunch of patients today. So I've written editorials about the role of complementary therapies. If I had to summarise it all, in fact, as usual, the patients have said it best. Some of you might have seen our sign on the corner of Thomas and Hay above the Acton Real Estate building. Beautiful comment from a patient of mine who simply said, if I were a cat, I'd purr. And that's really what it's about. We're not claiming cures, we're not claiming miracle solutions, but we do think that we relieve cancer symptoms, we reduce treatment side effects, and there's enormous scope for research to work out how to target some very ancient forms of healing alongside the best of Western medicine to get the best possible outcomes for people going through the cancer journey. Thanks for your attention. I'm very happy to take some questions.
I'd like to thank you for a wonderful talk and congratulate you. I've got two questions. One, has Steve Smith got any formal qualifications? And two, is it pathophysiological or placebo?
Both very good questions, particularly if you've met Smithy. In fact, he has. He's a former Navy diver. He was in the SAS. He had a terrible accident, injured his back, lapsed, strayed from the path, and he would probably talk about this very frankly as himself. And then saw a light, went to university, did one of the first exercise physiology courses that was available, and has a formal qualification in the area. That said, he is extraordinarily intuitive, extraordinarily so, and he can eyeball somebody and know what they're about very quickly, and I've seen him do it. And he, you know, we've set up a research program with UWA Exercise Physiology and deliberately kept Smithy out of it because the way he functions, and one of the lessons I've learned, in fact, is that there are healers outside what we label as the healing professions. There are people who have the capacity to have a great beneficial effect on others, and he's one of them. So I've just let him run with it the way he does it, and I'm satisfied that what he's doing is safe, and been there myself many times, and I think he's quite an extraordinary person. I could tell you some wonderful stories about him. The second question is also a good one, and actually it doesn't matter to me. If it's beneficial, then do it. There are plenty of things we do in mainstream medicine, and some of you might have read the editorial from the MJA in reply to the Friends of Science and Medicine, talking about some of the things we do in mainstream medicine that are also acts of faith, for which we don't have data. You can take the evidence-based medicine thing too far. There's a wonderful Christmas BMJ thing about the lack of randomised controlled trial evidence against jumping out of planes without a parachute, for example. So the evidence-based thing can go too far, but this area does need evidence. It needs well-conducted research, and it's very, very difficult to do, and it's even harder to publish in my experience. The funding for complementary research in Australia was described by one wag as homeopathic, and that was true until about 3 years ago. Some of you might have known about Senator Peter Cook, who died of pancreatic cancer. He initiated a Senate inquiry into complementary medicine, and that came up with a number of conclusions, many of which fit with what SolarisCare is about. I've lost my thread now. The Cook inquiry makes a number of recommendations and called for more research to be done. And in response to that, the NHMRC put up $5 million and established the National Institute for Complementary Medicine at the University of Western Sydney, who promptly funded a whole lot of projects looking at herbal oral stuff. And the stimulus for that was the Pan Pharmaceuticals disaster. And perhaps legitimately the focus of research funding has really been on the herbal oral stuff, and Solaris doesn't do any of that beyond having Brown's milk in the fridge. We haven't bought into that. It's too complex an area. You need to do all of the toxicity studies and so on. So in Australia, research into complementary therapies rather than the oral herbal stuff has been woefully underfunded. in my view.
I'd just like to share my personal experience with what you have told about tonight. My father was living in Australia for about 15 years, but he decided to go back to China 18 months ago, and then he was found to have a late-stage liver cancer of 15 centimeter size, so almost occupied the whole right liver.
You might have to talk closer to the
Sorry.
microphone.
So he's only have a very little of normal liver function, liver tissue left. So he started to have very intensive chemotherapy, and so he's, very difficult to tolerate the side effect. And when I was there, probably about 6 months ago, he's almost skin to bone. He took about every month he had the chemo. He took about 3 weeks to recover from that chemo before he have another week and start another chemo. So he didn't have any appetite and very sick, and I pushed him to consider complementary, traditional Chinese herbal medicine, and push him to exercise. And I went back just lately 2 weeks ago. He have met very considerable, significant difference. He's almost back to where he was and with normal strength. Before 6 months ago, he was hardly walk. He was just puffed up with breathless. But with the herbal medicine, with the regular exercise, he's 82 years old, but he exercised 2 hours in the morning and 1.5 hours in the afternoon, plus the herbal medicine, plus all the nutritional
Well, one thing that I would say in response to that is that I counsel my own patients not to take herbal supplements during chemotherapy.
Afterwards.
Sure, but during there's a large number of potentially very dangerous interactions.
Yeah.
That can greatly potentiate chemo.
So he didn't take chemo, the herbal medicine during the chemo, but when he returned home, then the herbal medicine actually helped him to return to his a normal state a lot faster. It just took about a week to get back to where he was, but before he took 3 weeks, and his skin to bone. Yeah, so that's really
I think we need to
considered. Yeah, thank you.
Can I just ask a quick question?
Sorry.
One important question, because as a GP on a day-to-day basis, we often have this problem of trying to sort out what's the sciencey stuff that might be a good complementary therapy and what's the total pseudoscience stuff. And like just in Perth recently, we've had the saga about the cesium chloride, and a few years ago we had that Trinado machine. As a GP, I mean, how can you sift sort of the wheat from the chaff? It's just a very difficult problem I find on a day-to-day basis.
There are 2 desktop references on all the herbal stuff that I'd strongly recommend. One is by Ernst, who's a professor of complementary medicine from Exeter, I think. And that's got a great list of all the herbal combinations and the known interactions and side effects. There's a book by Mark Cohen, past president of the Australian Integrative Medicine Association, professor of wellness at Swinburne, that he's written with Leslie Braun, who's a pharmacist who that was Leslie's slide, in fact, with the rising number of complementary publications. So Braun, B-R-A-U-N, and Cohen, that's M-A-R-C, Cohen. Their book is Australian-based and a really good desktop guide to herbal oral interactions. As far as the rest of it goes, Barry Castleth is a professor of integrative oncology. She's published a wonderful article which is How to Spot the Quacks. And there are 7 points in her article which include things like there's money involved, it's anecdotal only, and so on. And she has a great little checklist of things. But there's so much information that the answer to your question is that it needs a large number of people to start evaluating the literature. You can see what I've done in my area, and I'm happy to make that expertise available. You can email me through a standardhealth.wa.gov.au thing. And if I can answer it, I will. Oh, I'm going to have to apologise to the next speaker because it's time for my music therapy. It's band practice at 8 o'clock.